to your role in knowledge transfer for health promotion. Tips for writing a successful conference abstract. My name is Katie Dilworth. I'm Supervisor Nursing Quality Practice at Toronto Public Health, and I'm also past president to the Community Health Nurses Initiatives Group in Ontario, or CHNIG, and the Ontario Board Representative for the Community Health Nurses of Canada and chair of their National Conference Standing Committee. The Community Health Nurses of Canada acronym is CHNC. These are both the logos you see on this slide. CHNC holds a conference for community health nurses every year in Canada. The location of the conference changes each year to make it accessible to community health nurses from across the country. CHNIG and CHNC partner to bring the CHNC conference to Ontario for the second year. Many nurses from both these organizations participate by planning, volunteering, and presenting their work. This year's conference is June 17th to 19th in Kelowna, BC. We've been asked to provide information from nurses across Canada to discuss your role in knowledge transfer for health promotion and give you tips for writing successful conference abstract. In all domains of nursing, whether you work as a frontline community health nurse, in community health nursing administration, an educator, researcher, or policymaker, you all have experience to share with others that will contribute to the health of Canadians. The objectives for the presentation today are to inspire you to share your work at conferences, to provide you with the skills required to enable you to submit an abstract, and to enable you to find support you need to successfully submit the conference abstract. Information in this session today is not specific to the CHNC conference, but will help you share your work at other conferences as well. But I will use the CHNC conference for examples. However, the same applies no matter what your conference is. Today we will discuss why you should share your work. If it's a lot of work, why should you go to this trouble? We'll explore how you can get started. This is often the most difficult part. We'll then discuss how to prepare your abstract. It's important to consider several issues in the preparation to ensure success. We'll also talk about what comes next after the submission, how abstracts are reviewed, the decision process, and then, of course, we'll discuss the acceptance process. So why should you write an abstract? Why should you bother with all of this? As you've noticed by the title of the presentation, sharing your work at conferences is a key strategy to ensuring best practice in health promotion. If you're working in the realm of health promotion, then it's important to consider sharing your work in this way to ensure the best health for Canadians. Community health nursing practice should, as far as possible, be evidence-based. By using the best evidence, we have greater opportunity to impact health. Many community health nurses are involved in generating evidence about their practice. Informal research projects, practice development projects, evaluation projects, and literature reviews find the best evidence for their particular nursing specialty. All is important knowledge to share with our colleagues to increase our impact. Sharing often happens almost by osmosis with professional staff who work together. In casual conversations over coffee, or when professionals work together, often knowledge and experience is shared and important lessons are learned. But is this enough? Many have acknowledged it is not. It must go beyond this. Integrated knowledge translation and exchange can be a challenge. Some health professionals are involved in writing articles for peer-reviewed journals, but this is a very time-intensive and challenging process. It can take time to get through the publication process, and many are challenged with editors and their review teams determining what will or will not be published. One of the most successful methods we can use to share our knowledge is through presenting at a conference. Conferences bring together like-minded individuals who come to learn from their colleagues. Often sharing work at conferences is an initial step in the publication process if you choose to pursue this route. However, conference presentations are an opportunity to actively engage with your audience about your work. This format of dissemination allows for dialogue and exchange of ideas during further development of an initiative or research. It's important to share our findings in our work to better the health of the communities we work in. There's an incredible lack of publication and published information in many fields in nursing, including community health nursing. This has been highlighted in several recent reports. One of the major findings in a recent CHNC report was a study on public health nursing, primary prevention of chronic diseases. This project examined the literature for information on best and promising practices by public health nurses in prevention of chronic disease. The report describes that there was a dearth of literature found. The Registered Nurses Association of Ontario, CHNIG, and public health managers in Ontario recently collaborated to complete a literature review on quality indicators in public health nursing, and they found the same thing. There's been lots of reasons for this, cited, including that public health nurses work in partnership with other health professionals, and thus are rarely cited specifically in public health nursing interventions, and community health nurses are busy doing their work, not taking the time to publish. This is a very serious situation indeed, as it does not substantiate our work. Without literature, where are we to find information? I'd suggest that just getting the work, evidence, or learning out to relevant practitioners at a conference is a great start. Through this experience, you will learn indeed if this material is something you should think about publishing. I have to acknowledge the many personal benefits of presenting at conferences as well. Many health professionals in these tough economic times are unsupported by their organization to attend a conference unless they have an accepted abstract. The career advancement component of presenting abstracts also can't be ignored. By presenting at conferences, your names get known by others in your field. Many universities expect this of their staff, some of whom go on to publish their work. Through conferences, you will meet others doing similar work and build your professional network. Lastly, I can't understate the personal growth that occurs in presenting and attending a conference. Your writing skills, facilitation skills, and confidence will all get a huge boost, not to mention your enthusiasm you hold for your profession. But what's the reality? We've talked about the benefits, which of course include rapid learning, and you're being in a room with others who work in similar fields who can learn and collaborate and provide suggestions. This results in changing others' practice and creates networks of experts. On top of the career development you will experience. However, the cons are foremost in the minds of those considering writing an abstract. Issues such as it takes time, it's daunting, there are several confusing terms, and maybe you're not sure if you'll be able to go. Well, let's deal with each of these individually. It takes time. Yes, this is often the case, but by the time you spend in reflective thinking about your work is more than worth it. It can give you perspective about the importance of your project, the changes in your practice, and sometimes spur new ideas about your project. Sometimes in the process, you discover parts of your project that could be improved, leading to more successful self-promotion interventions. The issue of it being daunting to write a conference abstract is hard to escape. For those who've never done a conference abstract, they will do many drafts before they're ready to submit. However, you've taken the first step today by joining me here to learn about how to maximize your time and make the process easier. As with any learning, the first time is the most difficult. I suggest if you've not done an abstract before, work with someone who has. Also, when you have lots of time, anything is possible. Often conference calls for abstracts give you weeks to prepare the abstract. In the case of the CHNC conference, the call came out 2 weeks ago, and it's not due until November the 23rd. If you're accepted, the conference is not till June. You will have months to prepare your presentation. Also, we are here to help you along the way and are happy to respond to any questions you might have. The issue of several confusing terms is really one of development. Again, by being here today, you will understand these terms better. Also, most conferences, including the CHNC conference, list a contact person that you can ask questions of. Remember, questions lead to growth. You can also speak to others who have attended the conference in the past and ask their assistance with the terms. Some are reluctant to do an abstract because they're not sure if they're successful, if they will be able to go. Often health organizations are very willing to send their staff to a conference if there's an accepted abstract. Most recognize the tremendous value. Of course, you'll need authority to submit your abstract in the first place. But when your manager learns your abstract was accepted and your work is being recognized, they are sure to support you, especially if you're presenting at a conference with the caliber of the CHNC conference. It's not only good for the work, it's good for the profile of their organization and ultimately the health of Canadians. So you got the call from abstracts, and now how are you going to get going? What are the preliminary decisions you make? Well, if you missed the call, you can find it here at www.chnc.ca. Getting started is often the most challenging part. What will you present on? What work have you done recently that others would benefit from? Sometimes you might be involved in a research or evaluation project, a literature review, or an innovative practice initiative. This is your opportunity not only to share, but to gain insight from others on your work. Most importantly, you should consider, where is your passion? What gets you excited about your work? These topics often make the best conference abstract. Try to think about what others are interested in. Who attends the type of conference you're thinking of? What are their interests? Would there be nurses attending who work in communities similar to yours, with similar populations or on similar programs? What work are you doing that you think is unique? Is there something new about your work? New, novel ideas are often sought after for conference presentations. Could you adapt the work you've done recently? A colleague of mine was showing me an evaluation report she had recently done where they learned that an element of a program they were implementing was not working well for the participants. Important lessons were learned from this evaluation about a needed direction change in the program. Consider that, good or bad, this is a story worth telling. Perhaps others in similar roles are doing this initiative and would be very interested in the evaluation results that you have found. Consider what issues your organization wants to move forward. Are there issues that an abstract could attract similar-minded individuals from across Canada? Would presenting at a conference give you an opportunity to bring your issue to the forefront for others' minds? Lastly, and in many ways most importantly, are you having challenges with your initiative that you would like to network with others about? Most conferences offer some of their sessions as consultation sessions where you can plan time to consult with your colleagues about your issue. The network cafes at the CHNC conference are an excellent example of this. I'll give more detail about them in a moment. So when deciding if you want to present an abstract at a conference, consider what is it you want to gain. Do you want to consult with your audience? Is it intended to promote your idea? Or is it dissemination of information? I'm sure once you reflect on your project, you realize that there are plenty of ideas and reasons to submit an abstract. So what do conferences want? One of the first things you need to consider is who is the audience for the conference. Many organizations that hold conferences do so to increase the capacity and improve health, often by integrated knowledge translation for their members or target participants. Many are looking for papers that interest and excite their audience. This must be information relevant to their target audience. For CHNC, this is community health nurses in all domains of practice. Those in policy, those working in CHN education, those in direct practice, research, or administration. The reviewers for abstracts are usually members of the organization hosting the conference, and they are looking for abstracts that will be attractive to people like them. Most conferences publish conference objectives or goals on their call for abstracts. Often, prior to the conference planning cycle, the host organization will bring together an organizing committee who will work hard to define what the conference will be about this year. This always takes into account what is happening in the environment, and they create objectives, themes, and sub-themes for the conference. For For the CHNC conference this year, in addition to the central goal of building capacity through integrated knowledge translation and exchange, the conference hopes to inspire practice and policy that positively influences and impacts the health of individuals and communities. The conference name this year is Blueprint to Action, Influence, Inspire, and Inform, and reflects the CHNC Blueprint for Action as a foundation for this year's conference, which is aimed at strengthening CHNC's ability to improve health outcomes for people in Canada. Consistency with conference objectives, themes, or goals is essential for your abstract to be accepted. Each of the sub-themes from the conference contains descriptors that will help you determine what the conference is looking for this year. A third element that conferences are looking for is advancement of knowledge in an area identified. They want to spark new ideas, and ideas that will be interesting and exciting. If the initiative you want to present is unique, but could be utilized elsewhere, and especially if you are presenting new or never heard of information, your idea is sure to be welcome. Lastly, I think it goes without saying that all conferences are looking for true and accurate depictions of initiatives with all sources referenced and authors acknowledged. But is there a fit with the conference and your topic? Keeping in mind who attends this conference, what the conference objectives and formats will be available for you. The CHNC conference, like many conferences, has an amazing website where the conference presentations are hosted from past conferences. There's also a program at a glance from previous conferences, and this year a short video that helps give you a flavor of the type of conference it will be. Look at the past information for the types of topics presented. This will give you an idea of the abstracts accepted in the past and the types of presentations that occur. Speak to others who have presented and attended the conference from your organization and from other similar organizations. The program book for most conferences contains the abstracts for presentations from the previous year. So you might look for someone in your organization who went so you can see those abstracts. Often, presenters list their contact information on the slides presented so that you can contact them about their past presentations. Again, all of these are on the CHNC website. Don't hesitate to contact the conference organizers if you still want more information about this conference. The conference abstract usually has a contact name for further information. If you're not sure about something about the conference, you can send an email to the contact who will answer your question or forward you to someone who can. Most conferences are managed by an event management company, but have a number of committees who plan the conference and work to ensure the conference is a success. Be sure you read the call for abstracts very carefully. I'm sure by now the wheels are turning and you're thinking about ideas to submit for a conference abstract. But is your idea suitable? Some things you might want to consider is to answer questions such as, if your initiative did not do a literature review, it's always a wise step to have a quick scan to see what's out there in the literature. Maybe your project is one that is novel. Maybe there are other similar projects, or maybe the information is so new that no one has this information. One word of caution though, I mentioned the dearth of information about community health nursing. You might want to do a broad search to find possible related information. To determine if others are interested in your topic, chat with your colleagues about your idea. Do they agree with you that it might help others in practice? Do they think others would be interested? Consultation about your idea is always worthwhile. Consider going outside of your organization to chat with colleagues in other organizations. Maybe there is a particular component of your initiative that would be most helpful for others. It's important to consider about if your project is ready to present at a conference. Is your research complete? Maybe the timing's wrong. Maybe you've implemented a new program at your health unit that's very unique and you're planning to do an evaluation at the end of the first year. Is it worthwhile waiting to present your topic after that data from the evaluation is available? Remember, conferences are great for increasing evidence-informed decision-making. The ideas and evidence are both important. Lastly, consider what has or what might change as a result of your work in your community, province, or country. Remember, we all have the same goal of improving the health of Canadians. I recall an abstract presented at the CHNC conference last year about a small intervention by one health unit in Ontario that may well change practice in parenting programs across the country. Although it was a small controlled trial, the implications or impact on health are huge. Remember, success or not success both tell a story and can be useful to other community health nurses. You need to consider what type of conference presentation format fits your topic. Most conferences start with an opening keynote speaker where all the participants gather together in one room. The conference then frequently breaks up into smaller sessions called concurrent sessions, where material is presented in smaller groups in a variety of formats. There are usually about 6 concurrent sessions happening all at one time. Participants during this period of time will choose one of the 6 sessions that they are most interested in attending. The first and most common type of presentation is an oral presentation. These are about 25 minutes long, 20 minutes for the presentation and 5 for questions. The second type is a network cafe. I mentioned these earlier. In a network cafe, one topic is discussed for the duration of the 50-minute session. As a facilitator, you will engage and guide the group in discussion. Typically, the facilitator provides an overview and key points and then leads a full room discussion or small group discussions in the room. At the end, often the group comes together to talk about the information gleaned. The next type of presentation is a Pichakucha presentation. These are new to the CHNC conference this year. These presentations will have an opportunity to present 20 slides for 20 seconds each. The presentations will be 7 minutes long with a 2-minute question period for each. Next, there are poster presentations. New this year is poster presentations will be displayed digitally at the conference, where you'll have an opportunity to discuss your poster with conference participants at a scheduled time. And lastly, this year, we're bringing back the popular talking poster presentations. These presentations have an opportunity to present their poster during a breakout session. The presentations are 7 minutes long with a 2-minute question period. Posters will also be displayed digitally at the conference, where you'll have an opportunity to discuss your poster further with conference participants at the scheduled time. Once you have chosen your format, think about who is your intended audience. What impact do you want your paper to have, and what's the purpose of presenting your paper? Who do you want to reach? Who could this best apply to? Would they want to hear this? Do you want to consult with them, disseminate your information to them, and advocate for change? The audience could be decision makers, frontline staff, researchers, policymakers, or administrators. Think about who most needs to hear the main messages from your paper. For example, it might be those from government or academia. Think about, is there anyone in your organization who might be from one of those groups or knows anyone who you could talk to who could provide you with advice about this? Ask them if you're correct in your assumption that this group would be interested in this topic. They may help you to focus your topic towards areas you had not considered or expand it to other groups. When you do figure out what types of professionals could best apply the messages in your paper, tailor your messages to that audience. In the case of community health nursing, the CHNC conference attracts community health nurses from all domains of practice, and the conference organizers try to keep similar topics in each session. So if you need educators, for example, to hear your session, and you're doing an oral presentation, you may likely see another educator-focused session grouped with yours. The organizers are aware of the different areas in community health nursing and work hard to ensure there is relevant information for participants to attend at every concurrent session. If you think your topic might be relevant to a particular group that's not obvious in your abstract, then by all means say so. You could indicate this session will be especially relevant to ... So your session can be placed appropriately to allow and encourage this group to be able to attend your session. Authority with your employer to support your submission of an abstract is important to consider. At this stage, your presentation of abstract is theoretical pending acceptance, but is likely to get support from the onset. In some cases, your employer may be willing to support a writing team or members of the team with both the time and the financial support for travel, hotel, and conference registration fees. In other cases, this support may be just for the time to attend. In this case, do look for financial support from other sources, such as your provincial government or provincial associations. Many have resources available for conference registration. In Ontario, for example, the Nursing Education Initiative, administered from the Ministry of Health and Long-Term Care by the RNAO, does include conference registration fees as eligible for funding. CHNIG also has bursaries available to support members to attend the conference who need assistance with travel and hotel costs. Author guidelines are key and usually come in the form of a call for abstracts. The call for abstracts will contain the objectives, themes, and sub-themes I mentioned earlier, as well as key information you will need, such as word limits, section headings, etc. And most importantly, the final date for submission. We've talked about the types of information to present, such as research or evaluation project, but here's where you will get this type of information. Often projects that are considered ready for dissemination have reports available for you to adapt. Here you will find key information such as a possible literature review, theoretical background, methods, results, and discussion. These types of reports are an enormous support as you create your abstract. Be sure you have permission and acknowledge all sources of information during your presentation. And it goes without saying, if your project was the result of a funding received, this must be acknowledged as well. First, you need to identify your author team. But who should you include on your team? If it's your first conference abstract, you might want to collaborate with all involved in your project to create your abstract, especially if any of these authors might have experience with creating abstracts. As a courtesy, if you're planning to submit an abstract about an initiative that you've been involved in, it's appropriate to invite the key people involved in the project to participate. Some may decline, and their efforts towards the project can be acknowledged during the presentation. All must understand, if they are participating in the abstract, that they must contribute in a substantive way in every step, from abstract writing to preparation and presentation of the abstract. Some may wish to help with the abstract and presentation preparation without participating in the conference presentation. In this case, the presentation can acknowledge all authors during the presentation. Some organizations have authorship guidelines that outline whose name goes first. I suggest that early on you identify who will be the lead author for the abstract and what will be the roles of the various participants. This lead person will be the contact person for the conference, lead the writing team, and ensure all timelines and guidelines provided by the conference are met. For example, if you're asked to send your presentation to the conference organizers a few weeks in advance of the conference, this person will be in charge of ensuring that this occurs. Next, decide on the process for writing your abstract, such as what literature would be used, the problem definition, methods, results, discussion, conclusion. Often, something called a PAR, P-A-R framework is used. So what is the problem, the action, and the results? Organize your team, who your lead author will be, and how you will accomplish the work. Will each person write a section of the paper? I find that after an initial discussion with the team, it works well if someone creates a draft or straw dog, and others are able to provide feedback on this draft. Once you have your general concept, be sure to look for fleas on your straw dog. This is the possible spelling errors and grammatical mistakes that can impact your acceptance. In the creation of your abstract, think about what your main messages are. What are the most important points to cover? What gaps in knowledge does the paper address? What is the new and important contribution of this paper? In short, what's the so what? Before you submit, reread the author guidelines, the number of words, the format, etc., so that they can all be well understood. Your call for abstracts will often guide what content you include in your abstract. The CHNC call for the abstracts this year states that abstracts should state the issue, focus, or projected purpose in the first paragraph. Remember the power framework I talked about? This really is the P. Then the call for abstracts goes on to suggest that you should briefly describe the manner in which the issue was addressed or the study or project concluded. This would be the A, or the action taken. The call for abstract goes on to suggest that you should describe your findings, conclusions, or solutions to the issue or idea, and how those findings can be used in community health nursing. Well, this would clearly be the R, or the results section. You are next asked to clearly outline learning objectives. Make your learning objectives or outcomes SMART. SMART is a term coined by George Doran back in 1981 and is a list of key performance indicators or objectives. The letters broadly conform to the words, make your learning objectives specific, measurable, attainable, relevant, and timely. Recently, people have added ER to suggest that evaluate and reevaluate is important as well, making the acronym smarter. Lastly, I like to think about a title after I have the abstract written. I always try to think of something interesting, related to the theme, and enticing. Remember, if your abstract is accepted, conference participants often make decisions as to what session they will attend based on the title. Create your abstract in advance in a Word document or rich text format and be ready to cut and paste it into the required fields on the internet site. You will also be asked to submit a brief biography of less than 100 words that includes information about you. This can include your place of work, your title, your education, special awards you might have received, or significant professional association volunteer positions. You will also be asked for the names and identifying information of your co-authors as well. Within your abstract, you will be asked to identify the sub-theme that is most relevant to your abstract. This should be easy for you because you did this thinking back when you decided that this conference was a good fit for your work. You will be sent notification that your abstract has been received by the conference site on the day of submission, so be sure to watch for that. In the case of the Community Health Nursing Conference, abstracts will not be accepted after midnight on the deadline date of November 23rd, 2012. All abstracts are subjected to blind peer review. This means that all the submitted abstracts have had the identifying information removed. The abstracts are then divided up amongst the committee of volunteers for individual review. Each abstract is then reviewed using selection criteria by at least 2 reviewers. Selection criteria include relevance to community health nursing, the conference theme, and the conference sub-theme. The great news is that this volunteer group are actually your colleagues doing the abstract review and not an editor who may not understand your practice. When your abstract is accepted, and I know it will be, you will be notified in plenty of time to prepare your presentation. You must respond at this time to let the conference know if you can attend. If you do accept, you must register for the conference. You may be offered an alternate method of presentation if the reviewers feel appropriate, and it will be up to you to determine if you would like to present your information in this way. A small word to the wise. Copyright applies in the context of conference presentations. Presentations are routinely posted online. Conference presentations are increasingly refereed sanctioned forms of scholarly communication, and they're an important source of evidence in community health nursing. Sometimes they are referred to as gray literature. You must acknowledge the source of all non-original content in your presentation. The inference is that you are an original creator or copyright holder of any content which is not attributed to another source. Some content may require formal permission from copyright holder to reproduce or adapt. Attribution of non-original content impacts academic integrity, legal liability, and organizational credibility. Lastly, I'd like to suggest that you set goals and rewards to yourself and stick to them. Think about your goals for writing this abstract. Will you do 1 hour a week over the next 3 weeks? What's your timeline? Create it and stick to it. Ensure you include a bit of a celebration when you actually get your abstract in and when you receive the acceptance. Goals are well worth it in the end. I'd like to thank you for joining us today to talk about abstract submission. We've weighed the pros and cons to writing an abstract and clearly seen that there are lots of pros. We've chatted about the abstract writing process and the how-to, and made suggestions as to where you can go for help. Your project team are a resource. Others in your organization who've done abstracts, or others who've presented abstracts at the conference are another resource for you. Please don't hesitate to contact the conference team if you have any questions or need assistance. We're all here to ensure a